I would like to introduce our second speaker, Sherry Lee, who is going to be presenting on an improved and systematic method for physical demands analysis in the workplace.
Hello, everyone. I'm Sherry Lee or Xinming Lee. I'm an assistant professor from Mechanical Engineering Department at University of Alberta. Well, thanks for the invitation from the Occupational Health Clinics for Ontario workers and giving me the opportunity to give and share our research outcomes to the audience. So I might switch my topic a little bit to a general physical demand of a occupational operator, basically. So I'll talk about the improved and systematic physical demand analysis in the workplace. So just a little bit background on me and my research team. I'm the director of Occupational Ergonomics Research Lab at U of A, and we're roughly always having more than or say between 10 to 15 graduate students within our team. And our main research area would be on physical demand analysis, ergonomics, human factor. We do some 3D modeling, physiological measurements, and we also have motion tracking, eye tracking. We do some biosignal processing as well. With the AI support, we have computer vision, deep learning, virtual reality, augmented reality research going on as well. So our main research objective would be to improve the occupational operations by assessing ergonomic risks and investigating appropriate corrective actions to ensure the health and safety of the workers, operators, and so on. Our main application field would be in manufacturing construction industries, and we also have lots of research on the healthcare providers and trying to secure their health and safety. So within the next roughly half an hour, I'll talk about the improved and systematic physical demand analysis in the workplace, which basically, this is a very systematic documentation that documents the procedure to quantify and evaluate all the physical demand, environmental demand, sometimes include the sensory demands of not all the essential or non-essential tasks of the work. And thanks to the OHCOW, actually, we cited lots of your work and to support our research. So this document is very important because that documents the detailed information for us to evaluate the tasks. And then that would also provide us a good communication between us and the workers, operators. We can also use the information to identify risks and do risk assessment, and then take some proposal on the corrective measures. So we can determine proactive measures to mitigate the potential ergonomic risks or any other risks. Provide also detailed information on the job demand to the Workers' Compensation Board. In case of any claim or injuries, Workers' Compensation Board can refer to this document and get to know what happened, what was happened. Okay. Yeah, well, there are lots of templates in regards to PDA in the market that people can find. But general contents will include the force requirement, posture requirements, sensory demand, and the environmental demand. So, see, move on to the next one. So we care as a worker, or operators, we cares about our health and safety, right? We want to be comfortable on our occupational position, and we want to make things ergonomically friendly to us. And the employer also cares because they want to try to reduce the claims, injuries, and also reduce the compensation cost, basically. So if we have a very poor performance and have high injury risks, and then they basically needs to pay surcharge to WCB. But if we are having reduced injuries, reduced the claims, then we'll get a discount or basically a check back from WCB. So that's also relevant to the cost. And so in regards to all of those backgrounds and motivations, we have the following 4 objectives in the coming few slides that I'll basically talk about. Systematically assess the physical demand and muscle fatigue to reduce the musculoskeletal disorders and compensation cost. That will be the main objectives. And then we further split the main objectives into the 4 sub-objectives, including a primary and the basic physical demand analysis, including the strength, posture, sensory, physical, and environmental demand. And then we also developed a more systematic physical demand analysis to support the decision making. Further, we even automated the physical demand analysis with the support of motion capture and AI. And then later I'll talk about a little bit more on the muscle fatigue evaluation by using the physiological measurements there. So let's start with the first objective. Developed a preliminary physical demand analysis, and that's basically the basis for all the research coming along. Well, right now we mentioned that the need for physical demand analysis documents because of all the benefits listed here. But there are limitations because it takes time to collect all the information to be filled in the physical demand analysis form. And sometimes we just ask for a third party or a third person to be the observer and observe and collect the information. So the information may be subjective, and of course it's time consuming to do so. And there are lack of information for direct risk assessment sometimes. So there's a missing link between the physical demand analysis form and the risk assessment tools. So on the other side of the risk assessment tools, there are lots of lack of implementation in reality. And also due to the uncertainty, or it's going to be hard to take some body posture data collection. And also it's hard for us to do a timely assessment to update what the people are exposing to. So there's a gap between the two. What we want to do is to fill in the gap so that we can have a systematic physical demand analysis, and the information from the form can be directly used for the risk assessment tools. And then we can get a risk score there and take action from there. So from there, we propose a certain algorithm, which was already published in 2019, and starting linking the existing physical demand analysis form with the risk assessment tools. We also propose a new form, basically, that could generally cover the majority of the contents. Of course, the form can be customized based on the need and based on the type of the industry or the type of the occupational roles there. But that basically includes the strength demand, posture demand, sensory demand, environmental demand. We also do some assessment and identify the risks and propose some corrective or measures, or say modified work accordingly in advance. Okay, so this form, I am aware that the fonts are a little bit small, but this form is available from this paper, so feel free to just go and download it if needed. And of course, there are lots of templates available, and that is one of the forms that we propose. Okay, so moving onward, we also propose some measurements to do the observation, how to record the data. And then there's a time study proposal that can fast, quickly collect the frequency of each postures and strength demand and etc. Of course, we need photographs and basically photos to support our understanding on the tasks that we are describing in the form. So those photos may be needed, and sometimes workers' postures or operators' postures may be needed as well. So now, after using this new form, we are able to use at least these two existing risk assessment tools: rapid entire body assessment, rapid upper limb assessment, for further risk analysis. So I just provided one sample here for window glazing station motions. There are two options, and then we can compare which motions will be a better way for the worker or operator to complete the same tasks. So based on the result, higher means more risks, lower means comparably lower risks. And we can also change accordingly the postures per body segments, and then further reduce the risk. So based on the risk assessment tools, we can have a more detailed, proactive, modified work in this case. Okay. And in addition, we were able to apply our algorithm into a local industry partner. And eventually we got the 4 main ergonomic risks in a manufacturing company, which was static whole body posture, sensory demand, and manual material handling, and awkward body posture. I'll just quickly talk about each of them and by providing some samples there. So static whole body posture may include, for example, prolonged standing. So that may happen everywhere, basically. The operators need to stand in front of a workstation for prolonged time, for let's say 8-hour shifts, 10-hour shifts, with a little bit break, coffee break or lunch break in the between. But, well, people feel and reported to us that they feel pain on their feet and low back. So because they are exposed to a very high pressure to their spine and also to the feet. So what we provided as the corrective measures are to provide them the anti-fatigue matting or insole, things like this, that would make their more comfortable after 1 day shifts work. Or provide the foot rest for the workers or operators to switch the leg. Or basically, well, you can put the left leg on the footrest and switch to the right leg. And you can move your body weight to each of the leg. So basically, the muscle that we're using would be switched. In that case, we can reduce the fatigue of our muscles. So eventually, and gladly that the company implemented the anti-fatigue insole to all the workers. And by the end of the year, the workers reported that they feel more comfortable. And risk number 2 includes inventing material handling, which they have lots of heavy materials in their companies, windows and doors. They have to move the items all over the places in their facility. So instead of asking the worker to do that, we can provide some lifting machines, for example, vacuum lifting machine to lift the item, or have a direct transfer or feeding machine or overhead reeling system to provide a more handy transmission in the facility. Or the most easy way would be the last bullet point here, stagger the task among workers. So you alternate the tasks. You have the operators or workers in the facility. They can operate the task that would easily eliminate the risk in regards to manual material handling. Next one will be sensory problem. That's basically from our 5 senses. I provided one example that is in regards to the eye fatigue that may due to the nature of the operation or illumination or etc. We can provide, for example, this lady, she has to install the window small hardware to the window frame by telling where to install it and drill the hole and then install the hardware. Instead of asking her to do all the work, we can auto mark the location for her to locate and install the hardware ahead of the time. That would help her and reduce the eye fatigue, right? And also, sometimes you may see that the lady are using big drills. We can provide them the proper equipment to reduce the hand-arm vibration and etc. We can also limit the time that workers are exposed to the vibration or operators exposed to the certain tools. Of course, job rotation, that's the easiest way to implement and basically no cost as long as you have a good schedule for all the operators. The fourth risks would be awkward body posture, which may include back, neck bending forward, shoulder reaching forward. So you can tell basically from those images that we can provide the adjustment of the table or tilt the container a little bit then to eliminate this awkward body posture, right? Sometimes you may even face, so let me mute this sound, you don't need to hear that, sorry about this. You can reach, well, this operation requires the worker to reach above the shoulder to leave and move this window profile from the cart to a saw machine. But basically, what we can provide is to reallocate the machines, right, to make his life easier. So that would be better for the person, right, or provide a lifter or other alternatives for him to complete the task, right? So those can be simply fixed, but sometimes you just never stop there and think about how to change the way that you are doing. There might be other risks in regards to awkward body posture, including the back bending backwards, because this lady in front of the welding machine may sometimes needs to lean backward in order to reach the foot pedal at the bottom, but also to try to don't get any connection with the welding machine on the top. So instead, we can just move the foot pedal closer to her, then it's gonna be easier. So she doesn't need to bend backwards, right? There might be upper body posture on the elbow, wrist flex, or extension. That is due to the equipment or tools that the people are using. So we can provide them proper tools. So instead of the regular symmetrical plier, we can provide a plier that can bend itself. So that would help the worker to complete the task. Or we can also adjust the table, the location of the objects that the people are handling. There might be upper body posture on the kneeling, squatching, or crouching. Right, those are the postures that may make you feel more fatigued during the day. So instead, we can provide some ergo auto lifting frame to lift the item up, adjust the height of the machine workstations, or providing them kneeling pad, right? Or stagger the tasks. That would be most simply way for us to implement immediately. So luckily, by the end of the year, after the implementation of our suggestions, they got a reduction on their premium rate. That's something we want to see. And thanks for our collaborator that are willing to for me to share their status. And that was a project that we did even 10 years ago, and they even get a more reduction on the injury and claims in the later years. So we are expecting more through the pure implementation of this physical demand analysis. So we take actions, and even this collaborator, they have a nurse on site, so they cares about the operators. If one feel uncomfortable during the day or even after half days of the work, they can report to the nurse on site, and the nurse can take immediately action. So that's their advantages. That's something we can learn as well. Okay. So benefits from the physical demand analysis project has provided the more streamlined, user-friendly details on the job demands that would let the health and safety manager, nurses, and even physicians or the representative from WCB to get to know more about the job demand. And then also help with identifying and prioritizing the safety and ergonomic risks after the identification of them. And also provide sufficient information for hiring, training purposes of the employee, and also job matching. Then accordingly, we can provide modified work for the current injured workers as well. Also, PDA plays a vital role in running effective and efficient return to work program. It also supports the education session, and that's important in a organization. Stretching programs and other prevention proactive measures to reduce the injury eventually. So that was the first and preliminary physical demand. We spent lots of time on that, but we'll further introduce a little bit more on a more enhanced version of there based on our research. Second one would be a systematic physical demand analysis to support decision making. So we mentioned that there are all different factors that can be included in the physical demand analysis form, and we analyze them separately. And there are lots of current research that focus more on physical side other than all the factors included in the physical demand analysis form. So what we do is with the support of fuzzy expert system, we blend all the factors together to come up with one indicator. So this one indicator can prioritize which workplace would be exposed to the highest risk, and that should be the priority for us to try to solve it, right? So this is the algorithm that we propose, and then we apply it in another local industry construction company, and fine-tune our model, and eventually the result is pretty accurate and good enough for us to prioritize the workstations. And for example, we have to focus more on the roof station in this case to start with, and trying to reduce the injuries, physical demand of this workstation. So by using this fuzzy expert system-based physical demand analysis, that would help us to make decisions and take actions quickly, correspondingly. Okay. Next one would be the automated physical demand analysis with the support of AI and motion capture. So we know that there's sometimes hard for us to collect the physical data, body postures, especially directly from a third party. So what we propose is trying to automate this procedure and make things faster, because we want to have improved and continuous improvement in our daily life, and things may change. We couldn't just always hire somebody to observe us periodically, right? So we need certain fully or half or semi-automation there to speed up the process. So due to this research gap, we are trying to solve the problem by defining different operational activities based on their body joint angles and joint positions by setting the boundaries and tolerance there. And we develop a rule-based expert system that converts those joint angles or positions into the tasks, and then identify the frequency for them to expose to a certain tasks there. And then we automatically populate posture-based physical demand analysis to fill in the PDA form. So I just summarize the 3 steps here, but basically we need the support of motion capture devices and with 17 inertial sensors there. And then basically we can collect the data in real time, and we do some testing in the lab first of all, and then later we collect the real data on site with the support of another local masonry construction company. So basically we just collect the data by using the motion capture. And right now we are working on another project that would collect the data based on computer vision, and the outcome is coming very soon. So after the collection of the data by the motion capture, we can just directly extract the data. And of course, there are lots of coding required, calculated the activities, the frequency of using those activities, and further import it to our PDA form. So we can automatically generate a PDA form eventually that will speed up the completion of the PDA. Right, and the next one, I'll talk a little bit in regards to muscle fatigue. Due to the time limitation, I will only just briefly introduce this. In case of any further in-depth investigation on a certain activity, let's say a awkward body posture, we can use EMG sensors, of course, motion capture and force plate, along with the biomechanical simulation model to have a deeper analysis there. So it's hard for us to place needles to our muscle, but we can do is to use the experimental devices along with the simulation model to get to know what's the muscle force requirements for a certain activity. For example, this is for low back pain. So those muscles on the low backs are pretty small. Some of them are small and hard to detect. We cannot use needles. What we can do is to use the biomechanical simulation model. In that case, we can see whether there's force exertion or not. We also cross-validate through the between the experiment and also the simulation model. In that case, our result would be more accurate. So we also have papers in this area. So in case of a deeper analysis is required based on the PDA information, we can even do a further experiment there. Okay. So the outcomes from all the 4 aspects of the presentation are: we can reduce the claims and the workers' compensation board. We can also minimize the injuries and bringing direct benefits to the organization, provide quick evaluation indicators that support decision-making to prioritize that which workstation that you should focus more, and also automate the PDA form completion and avoid the human bias on the data collection. Right. Of course, we can also proactively assess the overloaded activities through the experiment and simulation model. Okay. Thank you very much for your attention and listening. I'm happy to answer any questions if you have. Thanks.
Okay, thank you. There was a few questions here.
Sure.
How would you define prolonged standing for analysis of static whole body posture risk assessment?
So based on the current research, or we haven't just used a time duration to define that. But usually the regular shift is 8 hours, but it's longer than that. And even within 8 hours, people are exposed to one certain posture for the entire shift that can be counted as prolonged. And especially if there's complaint in regards to the exposed to this certain posture, then we have to pay attention to.
Okay. How often should a PDA be updated?
So yeah, that depends on the basically the requirements or the plan of the company. I see some company update it annually. Some company even update it every 10 years. I think well, based on WCB, there's no strict requirement on that. Well, if in the facility or your operational procedure, if that changes, then what we recommend is you have to change the PDA accordingly, because the old PDA will no longer be able to represent the current operation anymore after the changes. So if you have any changes, it's recommended to have an update on the PDA.
All right. What kind of hazards are introduced when implementing some of the corrective measures, such as the vacuum lifting system?
So you mean the hazard of implementing the new recommendations?
Yeah, that's kind of what I get out of the question. Yeah.
Okay, yeah. So we can start with doing some test trials, and of course we do literature review and explore more by using the existing sources before really having a certain equipment there. So as long as well, after the in-depth exploration, if this is the comparably good corrective measures, then we can just, and of course, if the company has certain budget, then they can purchase the equipment and then have a try. And we will keep monitoring while during the test and trial version for either short or longer period of time. If it's a good measure to be approved, then we can just go ahead and widely implement it in the entire facility. Yeah,
Okay,
that was a very good question. Thanks for that. Yeah.
Okay, this one is a bit of a long question, so bear with me.
Yeah.
When analyzing jobs to determine the physical demands, if 5 people in a department do similar jobs, does your report reflect the worst case scenario of them as a whole? For instance, one may have high amounts of palm strikes, one may have frequent trunk flexion, one may have frequent kneeling. Your report would list high risk for all of those line items for this job, even though one person does not do all of those things.
So the physical demand analysis report is reported based on the job. So if 5 of them are working on the same, or even that working on the same task together, but still doing different tasks or still doing different activities there, right? So their physical demand would be different. So if you have the source and budget allowed, then we can basically have 5 different physical demand for them because they are exposed to basically different risks. So we record data for 5 different sets of data for 5 of them, and we analyze them differently. And based on the form, we record the strength demand, posture demands, environmental sensory demands. We also record the frequency. So their frequency that exposed to a certain risks may be different. So we have to set them as different tasks in that case and analyze them separately. Unless if it's another case that the 5 of them alternate the task and they can do all the 5 tasks, then we can use one form to represent that. And in that case, based on the one form information, we analyze and prioritize the risks for them. So yeah, well, I think I need further information to define how to prioritize among the 5 different activities within one task.
Okay, thank you.
Yeah.
What implication does the systematic PDA process have on the average business? How can we apply this process to our employees?
So basically, well, I'm in Alberta. In Alberta, it's required for every industry to have this PDA document, and WCB required that. They have provided the Alberta general template. I think we have template from each province and even each institute as well. So we can start with having a good template that would basically cover all the needed demands of your specific industry or organization. And then after having a good template, and then what people used to do is to hire ergonomists, but there are industry that hire university researchers as well, like us. That's why we had the project earlier. And then they hire us to be the third party and audit and observe what they do in reality in daily life. They don't usually ask themselves to do so because they are too familiar with the tasks and there might be bias. So usually they hire a third party to do so. And then the third party will basically join the facility physically there or even on site and do the observation. And basically the paper we provided provide you the algorithm and for example, how to do observation, how to do time study, how to write the information to fill in the PDA. Maybe by referring to or publish the paper, you can get the procedure of how to complete the form. And then we also take videos and to get back the information to the office and double check the input information in the form. That would make the entire procedure pretty efficient.
Okay, we're just going to try to get through a couple quick ones here so that we can get to the next speaker. But you mentioned physical, environmental, and sensory when looking at risk factors.
Yes.
What about cognitive demands?
Cognitive demand is not yet included in this physical demand analysis. Only sensory was included, but cognitive demand is something that we are trying to add to. So we are using some eye tracking and bio signals to currently processing the data, and hopefully later those can be added. And that's a really good point.
Okay, and how did you measure the sensory risk factors?
Sensory risk factors can be based on the signals from the eye tracking glasses, the bio signals, and also the survey. What we use the most is NASA load the survey. Then we can get whether the person is exposed to a high risk cognitively or not. And there are lots of sensors that can attach to our body, for example, EEG sensors, and also there are sensors to see whether the person is sweating or not. So those are the sensors that we are trying to add, and hopefully right now, based on our experience to the real application in the industry, we still need to work hard on it because the sensors are super sensitive. But we are trying to see how to implement it in real scenario there.
Okay, thank you very much, Sherry.